The orbicularis oculi is a muscle in the face that arises from the nasal part of the frontal bone, from the frontal process of the maxilla in front of the lacrimal groove, and from the anterior surface and borders of a short fibrous band. The function of the orbicularis oculi is to close the eyelid and help the passing and draining of tears. The external obliques have their origins along the lateral ribs 5 through 12 and insert into the linea alba of the abdomen, the pubis, and the iliac crest of the hip bones. The functions of the external oblique are to pull the chest downwards and compress the abdominal cavity. It has a limited action in both flexion and rotation of the vertebral column.
The internal oblique is found on both sides of the body lateral to the abdomen. It originates from the top of the pubic bone and connective tissue in the front of the pubic bone and the back of the thoracic and abdominal cavity. It inserts at the 8th through 11th rib and a connective tissue on the linea alba. The action of this muscle allows us to flex the trunk, or the motion of bending forward from the chest. It also allows us lateral rotation when a person turns to look backwards behind them. It can also let us use lateral flexion, which is when you perform side bends. The spinalis cervicus is located dorsally along the spine on both sides of the body. Its origin is the spinal process of C7 through T2 vertebrae, and it inserts from the C2 vertebrae, or less often from the C3 to C4 vertebrae. This muscle runs bilaterally up the spine. The teres major muscle helps maintain the posture of the head, as well as rotate, extend the cervical spine, and keep it in place. The teres major is a muscle mirrored on both sides of the body. Its origin is the lower ridge of the scapula, and it inserts at the medial lip of the humerus. This muscle is very important for arm movement and for holding the humerus in place. It is also the main reason we are able to do the funky chicken.
This is the masseter deep muscle. It is partially concealed anteriorly by the masseter superficial.
During chewing, the masseter is assisted by 3 other muscles. The 4 muscles work together to pull the jaw down and back up again.
This is the medial rectus muscle. It is located in the orbit, also known as the eye socket.
The medial rectus muscle is the largest of the eye's extraocular movement muscles. Its function is to keep the pupil closer to the midline of the body and helps move the eye up and down and from side to side.
The masseter superficial is located underneath the majority of the facial muscles, such as the zygomaticus and oculi orbicularis. One of the strongest facial muscles and is used for mastication to elevate the mandible and raise the lower jaw. The biceps brachii is a 2-headed muscle that lies on the upper arm between the shoulder and the elbow. It is essential to the function of forearm lifting, raising, and mobility.
The brachioradialis originates on the ridge superior to the lateral epicondyle of the humerus. It inserts on the lateral aspect of the styloid process of the radius. It flexes the elbow. The mentalis originates on the incisive fossa of the mandible and it inserts on the skin of the chin. It elevates and protrudes the lower lip. The spinalis thoracis originates on the T9 through T12 vertebrae and inserts on the T1 and T2 vertebrae. It extends the vertebral column.
The tongue is located in the oral cavity and it is used for the act of swallowing and chewing in most vertebrates. The openens pollicis originates from the flexor retinaculum of the hand and the tubercle of the trapezium. It functions to oppose the thumb and allows the tip of the thumb to touch the other fingers. The splenius cervicus is a muscle located in the back of the neck, and it connects from C1 to C3 all the way down to T3 to C6.